My name is Raj Kolpan, and I'm a medical doctor practicing in Claudius, Pretoria. And I see a variety of patients from all around Lordium and its surrounds. I thought it very, very important this morning for me to share some of my concerns about COVID-19. For many of us, COVID-19 was an illness that existed outside of Lordium, outside of our precincts. And looking at the figures on television, it was always about something happening away from our areas. However, I think it is very, very important for all our residents in and around Lordium to understand that COVID is in Lordium, and again, it's growing fast. The idea of this particular interview is not to be alarmist and try to raise fears amongst people, but it's just to share some very, very important information that I see happening in Lordium. Their knowledge about how we could prevent COVID-19. COVID-19, like many of our doctors mentioned, and you don't invite it into your life. You've actually got to go out and get it, either from somebody or stay at home and let somebody with COVID-19 visit you in order for you to get it. So the concept of keeping COVID-19 at bay is very, very simple. So many people have heard it ad nauseum, that again, washing your hands with soap and water for at least 20 seconds, maintaining social distancing, wearing a mask consistently. I went this morning into the post office at Lordium and found many people wearing their masks at their chin down here. I'm not so sure how that really helps, but many of the people that I tried to tell them that this is not the correct way were actually upset with me. So one of the things that I see happening in Lordium is that people are not practicing social distancing. People are not concerned about either preventing themselves from getting infected and not concerned about infecting others, because I think subconsciously many people believe that they would not get it, that this is something that others get, other people get COVID-19. So my idea this morning is just to share some of the things that I see in my practice. Many people would come into my rooms. I have sanitizers. I have an area where they could sort of go and collect a mask in my surgery. But until and unless I came and instructed them, none of them would do it. So I think from a social responsibility point of view, we need to be very, very careful about what we do in this very, very troubled times, and understand that if we unable to measure something in our community, we unable to manage it. So each one of us are responsible for what we do. And I want to urge our residents of Lordium to truly become a little bit more conscious about everything that you do, everything that you touch, everybody that you come into contact with. We should be treating everyone as a possible carrier of COVID. And in that way, we would prevent ourselves from getting it. There are a number of other things that I'd like to mention that, again, there's a tremendous amount of shortage of the test kits, especially in the public sector. The private sector is still coping reasonably well. So we want to maintain or ask patients to maintain their contacts with their doctor. Many of our doctors are freely available to give you advice as to how to self-quarantine, how to get tested, and so on. Rushing to a doctor's rooms, a crowded doctor's room, can actually be counterproductive. You can cause the spread of this illness. So I think your first port of call should be that if you suspect yourself or any other family member of having COVID-19, contact your family practitioner and get the appropriate advice so that you may take the right kind of actions in order to prevent it.
I am Sitar Abu Baker, and I'd like to share with you one of my personal experiences of how quarantine does help. I had a patient who came in on the I did a virtual consultation on the 21st of May, and when I heard the symptoms, I sent the patient to go and do some testing by WhatsApping the form to the wife. He went for the test and he was positive. We asked him to self-quarantine, and he self-quarantined until today. And today he went for the test and it is negative. But in spite of it being negative, we have still asked him to quarantine for another 2 weeks to make sure that he remains negative. This alone shows how much Just self-quarantine can help to prevent us getting this, uh, uh, to prevent the spreading of this virus. And as Dr. Raj Kolapan said, this virus is not going to come into your home as an uninvited guest. It's only going to come in if any member of your family or any visitor brings it in. That is why it is so important that we maintain social distancing and we don't have very big crowds in our home. That is absolutely very important. There is no vaccine for this. There's no treatment for COVID. The only thing is prevention, and prevention is, as Dr. Raj Kolapan has mentioned, and the most important thing is to stay away from big crowds. And when it comes to shopping, everybody gathers at a supermarket, but it's so easy to just order by phone, and your groceries will be delivered to you, and that will also help us not to spread this virus around. Dr. Baba.
How's it, guys? It's Hamza. I think most of you guys might know me or might not know me. I'm just going to give you some advice. I think this advice extends from majority of the doctors in the Lojam area. I can't speak on behalf of everyone, but for most of the people that I've spoken to who might be here or might not be here, have agreed that we are now coming to a point in Lojam where, unfortunately, due to a barrage of us not listening, unfortunately, I have to be straightforward, of us not following social distancing, of us thinking that COVID-19 was an outside problem. We're now starting to see that the amount of cases in the Lojam area have been increasing. And I'm sure the doctors would agree that over the past week, we've seen a significant amount of new cases that have occurred. In fact, to such a point that it's increased from Saturday last week till today, significantly more than what it increased the entire time that we were under the lockdown phase. And that is posing a bit of a problem. What we need to do is we need to follow simple rules. It's not difficult. Social distancing, washing hands, those are the most important things. And I think every doctor will reiterate it to you. In terms of the outcomes, or in other words, what will happen, should you have COVID-19? Well, most of the people will undergo self-quarantine at home, and most recover. So it's not all doom and gloom. However, for us to do this and to ensure that we get the maximum benefit for our neighbors, for our friends, for our parents, and all those people who are at risk, and I'm not even going to go through that because I'm certain that you'll see it everywhere, and it's been probably put into your face so many times that everyone knows. If we can just look after each other, take care of our family, take care of our friends, we will succeed in trying to bring this thing to bay. How do we go about doing that? Stay socially distant, or was it social distancing? Ensure that you make sure that you have the proper hygienic controls in place. And if you can do that, to a certain degree, you will be able to try and prevent or curb the spread of it. But we need to listen. This goes out specifically to the supermarkets, to the areas out there where you can go and buy food. Unfortunately, or I should say fortunately, I haven't been to much of the places, but from what I'm hearing from a lot of my patients, that social distancing needs to be brought in at a much higher degree in all of these places. And unfortunately, we are at fault. We as people of Lojam and the surrounding areas are not listening. And I think the time has now come that we have to be serious and understand that this is a condition that occurs. It is a virus that occurs. It's not a dream. We're not living in a movie. It's real. And once we realize it's real, we can do everything possible. We'll do everything possible to try and assist everyone. From our perspective, the elderly are most at risk, and we'd like to keep the virus away from the elderly. So if you know somebody who's near you, who's elderly, please go out of your way to try and help them. Go out of your way to assist them. If they need groceries and they're unable to get it, please go and help them. Because the less we can get our elderly out there, the better it is for us. The doctors in Lojam and the surrounding areas have been phenomenal with their responses in terms of helping out, giving advice over the phone with virtual consultations. And I know they've all been inundated with calls in trying to assist everyone. That will not stop. I'm sure your local GP and every single one of your friends who are doctors, or people that you might know are doctors, or even the helplines will be able to assist you. So please, if you have any queries and you're worried about something, contact any doctor. I'm sure they'll assist you and they won't have any problems with that. But please take care of the elderly. Try and keep the elderly at home. But I can tell you now, the supermarkets, the food places, all those places that are out there, please guys, try and increase your controls, try and ensure that you don't have any problems, and try and make sure that you keep social distancing and hygienic controls in place. Okay. The figures have shown that from one person who is positive, you can infect about 129 people. When it comes to death rates and all of that, I'm not going to be going too much into that. I don't think we should be going too much into that, because that is not something that I personally believe that's in your hands. Well, not I personally believe, but everyone believes that. Most people believe that. But what we should start doing, however, is trying to ensure that the person next to us doesn't have to suffer the same consequences of going and getting sick. Because a lot of the people, although are those that are asymptomatic don't have any problems, but those who are symptomatic, I've spoken to quite a few of the people on the phone, and they're finding it hard. They're finding it difficult to breathe, to such a point that people feel like they're drowning. Now, if you've ever been in a swimming pool and you've drowned for 5 minutes, or felt like you're drowning for 5 minutes, it didn't feel like much. But imagine doing this for 24 hours a day, 7 days a week for 2 weeks. It's not that easy. So, in medicine, there's a simple rule. First, do no harm. And we should stretch that to our friends, to our colleagues, to our families, and everyone at home, especially the elderly. On behalf of those people that I have spoken to, of the doctors that I've spoken to, and again, I'm going to clarify, this is not every single doctor in Lojam. I'm pretty certain that most of us are on the same wavelength, and we all agree that we need to start making serious changes in our areas, Lojam, Claudius, Elder Glen, all our areas. And hopefully, if we can start doing that, we can curb this thing and attack it before it attacks us.